Breastfeeding is a beautiful and natural way to nourish an infant, fostering a unique bond between mother and child. However, when a woman becomes pregnant while still breastfeeding her older baby, she may find herself faced with a new set of challenges and considerations. In this video, we will explore the concept of breastfeeding while pregnant, its potential effects on both the mother and the nursing baby, and the vital factors to consider during this unique period. It's the Mom Hack YouTube channel. Subscribe and let's get started. Breastfeeding while pregnant means that a mother's body must meet the nutritional demands of both the growing baby inside and the nursing baby. Proper nutrition is crucial to ensure the health and well-being of both mother and children. Mothers should focus on consuming a balanced diet rich in essential nutrients, including protein, calcium, iron, and folic acid. Staying well hydrated is essential during pregnancy and breastfeeding. Pregnant mothers need to maintain an adequate fluid intake to support both pregnancies. Pregnant women who continue to breastfeed may experience increased calorie needs due to the demands of pregnancy. However, excessive weight gain should be monitored and discussed with the healthcare provider. Breastfeeding during pregnancy is generally considered safe for most women with healthy pregnancies. It does not typically cause miscarriages in normal, low-risk pregnancies. However, there are some important factors and considerations to keep in mind. Before continuing breastfeeding during pregnancy, it is essential to consult with a qualified healthcare provider, such as an obstetrician or midwife. Every woman's body and pregnancy are unique, and individual circumstances should be evaluated to ensure there are no specific risks or complications. In uncomplicated pregnancies, breastfeeding is unlikely to pose a threat to the developing fetus. The body is well equipped to handle the simultaneous demands of growing a new baby and nourishing a nursing baby. One concern some people have is that breastfeeding might lead to uterine contractions, potentially triggering a miscarriage. However, in low-risk pregnancies, the hormone oxytocin, which is released during breastfeeding and can cause contractions, usually does not reach levels high enough to pose a risk. The uterine muscles are generally not sensitive enough to respond significantly to oxytocin until later in pregnancy when it's time for labor. In high-risk pregnancies, or if a woman has a history of preterm labor, healthcare providers might recommend weaning from breastfeeding to minimize any potential risks. This is because some studies suggest that nipple stimulation, which occurs during breastfeeding, can release higher levels of oxytocin in some women and could potentially lead to stronger contractions in certain circumstances. However, it's important to emphasize that every situation is different, and decisions should be made based on the specific medical history and advice from healthcare professionals. Breastfeeding can be physically demanding, and the nutritional needs of both the mother and the developing baby should be met. Proper nutrition, hydration, and rest are crucial to support the health of both the pregnant woman and her unborn baby. As the pregnancy progresses, some women may experience a decline in their milk supply, and the taste of breast milk might change. But this rarely happens. Some nursing baby may wean themselves due to these changes, while others may continue to breastfeed without any issues. As the mother's milk supply can changes, it's essential to ensure that the nursing baby is receiving sufficient nutrition. Introducing solid foods and supplementing with appropriate formula, if necessary, can help meet the child's nutritional needs. Pregnant women who plan to continue breastfeeding should consult with their obstetrician. Breastfeeding during pregnancy is generally safe for women with low-risk pregnancies. However, individual circumstances vary, and it is essential to consult with the healthcare provider to assess any potential risks and make an informed decision. Breastfeeding while pregnant is a personal choice that varies from woman to woman.